My name is Dr. Ibrahim Khan. I am a family medicine practitioner with Lake Region Healthcare. Wanted to bring you the first in this anxiety series of videos that we're going to be doing. This is video number 1. This is going to be centered on an introduction where we talk about 4 things. Firstly, I wanted to talk about some definitions of anxiety. Second, wanted to talk about maybe some of the types of anxiety that you may or may not be experiencing. Third, wanted to talk about when to possibly go in to see somebody. And then fourth, I wanted to talk about different treatment options that might be available to you to help with your anxiety. So first, definitions. What is anxiety? A lot of the medical definitions kind of center on this perception of fear that you might have on your immediate environment, maybe a future environment. I think it's much easier just to kind of define it as worry, just colloquially using everyday terms. Do you have excessive worry about certain things about your life? Do you have excessive worry generally? And that kind of brings us to the next kind of aspect of this video very quickly, definitions. So you could have generalized anxiety. If you have worry all the time, you wake up and you're worried about everything. That could be possibly generalized anxiety. On the other hand, you could have anxiety to certain situations. Let's say you don't necessarily like flying, and you have a lot of anxiety that gets provoked when you fly, or you don't necessarily like MRIs or other kinds of scans where you might have like to be in a claustrophobic environment. There are some, public speaking is another kind of possible life event that could cause some anxiety. So your anxiety could be due to a very specific situation, and then your anxiety could also be general. And it's very important to kind of note which one that is, because some of the things that you can do are very, very different to treat either type of anxiety. Before we get into the treatment, I did say that I would comment on when to go in. This is very, very individual. I would say my advice is when to go in is when it's affecting your life in a negative way. And I think that's going to be different for everybody. So if you feel like this is really kind of weighing heavy on you, it's kind of not necessarily making your day easier at all, I would go in. To go in to see somebody is not a sign of weakness at all. It's actually, I think, a sign of strength, because you're doing something productive about it, and you could be able to learn different techniques or start possibly medications that can really help with this. So that brings us to the last aspect of our video, treatment options. So there are a number of different treatment options that can really, really help with anxiety. In fact, the next series of videos that I want to do in this anxiety series stem on those treatment options. First video I want to do is on basic kind of care that you can do. The second is personal activities that you can do to kind of help with anxiety. And the third is almost like this meditative monk-like activities that I think that we can do to help with anxiety. So those are some of the lifestyle interventions that I wanted to focus in on this series. But when you go in to see your healthcare provider, they may also talk to you about medications and therapy. There's a lot of research that shows that medications may be a good idea, and it's going to depend on you on an individual basis, that may help with your general anxiety or your situational anxiety to really help get you through some of those situations. There are therapy options, counseling that can really, really help as well. So a really good discussion with your primary care provider, I think, is always a good idea. And together, the two of you can kind of chart out a plan as to what treatment options are going to be the best for you in your individual case basis. I hope this really helps. I'm excited to bring to you some of the other lifestyle modifications for anxiety in the next series of videos, and we'll look forward to seeing you.